The first meeting in London, we had just over 50 people there. We've had just under 140 people this year, and the big difference to other meetings, the level of people who come to these meetings, they're virtually all consultants. So it's very little instructional stuff, much more interactive, talking about current problems. And we've really thrashed out a lot of things that we're all dealing with, ideas we want to look at, and where we want to take the research in the future.
Good quality research, good quality dialogue, and learn from each other is the key part of this as a meeting. And the meeting has been an exemplar of how that can actually happen in any part of medicine, but particularly in orthopaedics and trauma.
And it's really gone from strength to strength, because we've been coming here for 3 years now, I think, and we've seen the numbers grow, and I think this year they're kind of oversubscribed, so which is really good.
The support that there is from industry here is fantastic, and it's amazing implants that are available to look at, and it's really nice to be able to get your hands on them and just see the sets and meet the representatives from the companies.
I came to the OTS last year and actually the year before, and as a new trauma surgeon, I think it's a fantastic meeting because it's in a sort of early development, and it's so good to hear people who are experienced and sort of learn from all the lessons that they've had along their career.
Zimmer Biomet come along to the OTS meeting every year. It's a very good meeting for us. It's a great opportunity for us to show our products to some of the country's leading trauma orthopaedic surgeons. And especially the breakout sessions are really good for us because it's a good opportunity to have discussions with trauma surgeons and a chance to showcase our products.
As the largest provider of trauma products around the world, this gives us a great opportunity to work closely with surgeons to gain insights into the priorities and of course showcase and demonstrate some of our new products.
The fact that you have people openly communicating with each other and sharing information, that's an enormous benefit to patients.
It's great to catch up with colleagues, and probably the best thing about the meeting is not necessarily the lectures, but it's all the chat between. I've come across this fracture, how did you manage it? Well, I did this, it didn't work so well. So it's such a great wealth of knowledge in quite a compact environment.
This is the third time that we have provided a stand and representation at the meeting. This allows us to continue our support of the expert trauma group here in the UK, and we're delighted to be here.
I found the breakout sessions very useful from a sort of case-based discussion point of view, where they put up the radiographs and then found out lots of different opinions from different consultants. So it shows that not everybody has the same idea for the management of each fracture.
It's more the opinions of senior colleagues on treating difficult fractures and how to use some of that knowledge to care for our patients, and also a bit of reassurance that what we're doing at work which is difficult, and we think, are we doing this the correct way, is what other units who do similar work to us are finding as well.
There are lots of things out there where everyone's got a great idea, but they just don't have the numbers to be able to put that into practice. So by sharing experience, seeing what other people are doing, we're going to drive patient care forward like it's never been done before.